All right, Dr. Stahl, please describe a normal penis.
Really?
Hey everybody, I am Chad Callahan from HIMSS, and with me we have Dr. Peter Stahl, a board-certified urologist, a nationally recognized expert in sexual medicine, and the Senior Vice President of Male Sexual Health for HIMSS, also an internationally renowned fashion icon. Peter Stahl, here we go.
That's right. It's nice to be with you, Chad.
Thank you for coming. All right, we want to get down to it. So, all the guys at home want to know, specifically the guys at home, not me at all, I don't have any interest in this question. How big is the average penis?
That's a great question. And it's a hard one to answer.
A hard one. Dr.
Yeah. First, let me give you some context. Men tend to underestimate the size of their penis.
Of our own penises.
Of their own penises.
Okay.
And they tend to grossly overestimate how much it matters. There are big studies out there.
Big studies.
Big studies. And some small studies. And some medium-sized studies.
I mean, the studies are sized across the spectrum.
They are.
Yeah.
But if you look at those studies in a serious way, men believe that their penis size is important to their sexual partner. And way fewer sexual partners have that same view.
So men are hyper-focused on the size of their own penis. They really think it matters, but their sexual partners could care less.
Yeah, not that unexpected, right? But yeah, the data really clearly tell that picture.
I think that is incredibly important and incredibly valuable, but the men at home also want to know.
They want a number.
What is the number? Dr. Stahl.
Okay, well, it depends a little bit, but the number is roughly a little more than 5 inches of erect.
Of an erect penis.
Penile length,
Okay.
measured from the pubic bone, which is where the penis attaches,
Okay.
to the tip of the penis.
Just over 5 inches erect. And do we have a measurement for what a flaccid penis would
We
be on average?
We do, but that depends how you measure the flaccid penis.
Okay.
Believe it or not, I've written a textbook chapter and a paper about how to measure penises.
We have the literal expert on measuring your penis with us today, ladies and gentlemen. So tell us how to do it.
Well, there are 2 flaccid distances that people talk about.
Okay.
One is skin to tip. So you look just visually at where the base of your penis reaches the lower part of your abdomen, or where the pubic bone is.
Okay.
And you measure that distance.
From like your abdomen, like the lower part of your abdominal area to the tip of your penis.
That's right, exactly where the penis inserts into, it's not really the abdomen, but the very lower part of your abdomen or pelvis.
Right.
Right under your pubic bone. And you do that just visually.
Okay.
Or you can press in with a ruler all the way to the pubic bone and measure the bone, no pun intended,
I mean,
the
that
bone
sounds-
to tip difference.
So that's going to give me a slightly larger measurement.
Absolutely, not just slightly. Actually, a pretty big portion of the penis is internal.
So that's how I want to measure it. I want to measure it by like pushing it because,
If you would like the largest number possible, yes.
I mean, this isn't about me, Dr. Stahl.
I
This is
understand.
about the gentlemen at home who want to know whether or not their penis is normal. Wait, how did they do it in the study?
One of the things I didn't mention is that the amount of stretch you put on your penis also makes a big difference.
Okay.
So it's one thing to just measure your penis as it's hanging down.
Yeah.
It's another to grab the head of your penis, pull it on maximum stretch,
Yeah.
and then measure either the skin measurement. Most accurate measurements are in the stretched, flaccid state.
Stretched flaccid state.
Yeah.
Okay.
But more recent studies and other studies have actually done erect penile measurements. And usually that's a self-measurement done at home under pretty protocoled experimental conditions with very detailed instructions.
Okay. So when we are looking at this Jenga set, like, this is the size of a normal penis, yes?
No.
I mean, this looks like just over 5 inches to me. Am I measuring incorrectly?
I think you might be. I think you need to...
Like, show me on the Jenga set. What are we looking at? What is normal here?
Well, I think we need to shrink the Jenga set.
Okay. So put
And
the Jenga
squish
set,
the Jenga
put it in
set.
some nice cold water, get it nice and shrunk.
Right, which brings up another issue, which is there's actually a muscle underneath the skin of the penis called the dartos muscle.
The dartos muscle.
Yeah, and it is the muscle that is responsible for shrinkage, right? Which is a real thing.
So there's a muscle we can blame for this.
There is absolutely a muscle that
Is
you
there a
can blame.
surgery to remove this muscle?
No, there is not, because
So we're stuck with it.
we're stuck with it.
Okay.
We are stuck with it. But the way someone's penis looks walking around naked depends a lot on ambient temperature and how anxious they are. And that is, I think, something that bothers a lot of men.
So literally my anxiety can influence the size of my penis.
Yeah.
Okay, wait. We were talking a little bit about people overestimating the average size of the penis. So people have unrealistic expectations about their penis needing to look like this Jenga set as opposed to being the shrunken version of this Jenga set. Can you tell me a little bit more about these expectations that folks have?
Yeah, I think culturally men tend to correlate having a big penis with virility and strength and desirability.
Yeah.
And that's not what we see from their partners at all.
Okay.
But that is a very pervasive misconception in almost all cultures. And it creates a lot of anxiety and, in some cases even avoidance of sexual partners.
Yeah. Let's talk about the outliers. What are some conditions that might be outside the realm of typical?
Well, there is a condition called micropenis,
Okay.
which has a tough name,
Yes.
but is a very uncommon disorder that affects about 1 in 10,000 men.
Okay.
It is associated with a couple of congenital syndromes, and it's really, in most cases, related to hormonal abnormalities during fetal development.
Okay.
So it's really rare. Of the 100 people every couple of months that come and see me worried about a micropenis, almost nobody has one.
Okay. What is the clinical definition of a micropenis?
A micropenis?
Micropenis.
Yeah.
I'm trying to make it less stigmatizing, this name, micropenis.
I think it's a good idea.
Let's give it like a Greek pronunciation. We've got that dart muscle and we've got the micropenis.
Right, okay. So the clinical definition of a micropenis or micropenis or whatever we're going to rename it is having a penile length that is more than 2.5 standard deviations below the mean penile length.
Okay.
So that translates roughly to having an erect penile length of around 3 centimeters or less.
Okay. So if you have a micropenis, is there a way to do anything about it? Like, is this something you need to see a doctor about if your penis is not a satisfying length for penetrative sex?
Yeah, so it's really important to realize that that is a really rare condition, and that the ability to satisfy a partner is, in almost all cases, not contingent on penile size or length at all. But for the rare affected men who have severely limited penile length, there are medical options and surgical options, but those really need to be approached carefully.
Yeah. So that's something you want to see your doctor about if you have suspicions that might be something you're working with, and that is something your doctor would talk to you in more detail about.
Yeah, not just any doctor. A reproductive or sexual medicine focused urologist.
A board certified urologist.
Somebody like me.
An internationally renowned expert in male sexual health.
And a fashion icon.
And a fashion icon, yeah. Are there any other conditions? We've dealt with the elusive micropenis. Are there other conditions that might lead your penis to look outside the realm of normal?
A couple of things come to mind. One is, although micropenis is extremely uncommon.
I don't know why you keep mispronouncing it.
I'm sorry, micropenis is extremely uncommon. Being worried you have a micropenis is much more common.
Okay.
And there are people that get really perseveratively focused on worrying about the size of their penis, and it's really a form of body dysmorphic disorder, where there's just like a pathological worry that can almost take over your life.
So is this an actual diagnosis, this dysmorphic disorder related to your penis?
Yes, it is. And it's really a psychological condition, and it requires reassurance. Obviously, someone to examine you to reassure you that you don't have a micropenis or a micropenis.
Right. All right, Dr. Pete, we have covered the elusive micropenis. Are there other conditions that might lead you to have or at least the appearance of a smaller penis than quote unquote normal?
Yeah, there are. And one of the things that comes up a lot in practice is something called a buried penis or a hidden penis. And it can be very distressing and actually anxiety provoking for a lot of men. And what that really is having a large suprapubic fat pad, which basically means a big belly with fat kind of going down into the area where the penis comes off of the body. And what that does is it hides the bottom portion of the penis from view.
Got it.
And in cases where someone is more than just a tiny bit overweight, or it's really cold outside, or a combination of the two, it's not uncommon to have a situation where the penis completely retracts inside some, what appear to be kind of folds of adipose tissue or fat.
Okay.
And that, I think a lot of men feel embarrassed about that.
What can we do about this and by we, I mean the folks at home, never me, always the folks at home. What can we do about this suprapubic fat pad that is villainously hiding our penises from us?
Well, you can lose weight. Or, sorry, they can lose weight.
Did you see the way he looked directly at me when he said, you can lose weight?
Yeah, I think weight loss, exercise, anything that can help get rid of that fat tissue is very, very helpful. There are procedures where like plastic surgeons will remove that fat with liposuction or other plastic surgical techniques to surgically take care of a hidden penis, but far and away the best approach, if it's feasible and possible, is to lose the weight the old-fashioned way, slowly over time. But sometimes just reassuring somebody that it's not their penis that's small, it's the fat pad that's big, goes a long way.
Yeah. If we do not have one of these conditions, if we are somewhere in that bell curve of normal, is there any way we can enlarge or at least make our peni look bigger?
There's a lot of interest in penis enlargement. It's something that men have been trying to do forever.
Yes.
There are ancient civilizations that used to hang weights from their penis, which is a real thing. We don't recommend that anymore. But there are some non-invasive strategies that some urologists have suggested to patients that are trying to enlarge their penis because of things like scar tissue after having their prostate removed or having certain clinical conditions that can sometimes shorten the penis. But in general, those non-invasive techniques are only minimally effective. And I'm talking about things like using a vacuum erection device, so a cylindrical chamber that goes over the penis, is activated, creates a vacuum, brings blood into the penis, and there are kind of exercise regimens of repetitive use of a vacuum erection device that in some studies have shown a very slight marginal benefit. That's probably totally unimportant and unnoticeable to most people.
So that's a penis pump, and it kind of works, but not really.
Yeah, I'd say more on the not really side.
Okay.
There's also something called a penile traction device, which is just what it sounds like, a penis stretcher. There is some data that works in men with diabetes or in men who have had their prostate removed to restore a centimeter or two of penile length, but there are no data for just straightforward penile enlargement outside of specific medical conditions. And in general, most men don't want to stretch their penis for even 2 minutes, let alone 30 minutes twice a day for 3 to 6 months, which is the protocol there.
Also protocol in medieval torture.
Touche.
Yeah. So if you have scar tissue, it might help, but that would be a super clinical condition in which it might help. But if you've just got a quote-unquote average penis, like, this is not going to do anything.
It's not going to do anything. It's going to take a lot of time, and there can actually be some harm that comes from the use of some of these devices.
So what I'm hearing is, if you are wondering, can I safely enlarge my penis? The answer is pretty much no.
The answer is probably not. And safely is a relative term. If there's a 1% to 2% risk of a really bad complication to make your penis slightly bigger, I would make the argument that that really isn't worth it. Because if you're if you're part of that 1% to 2%, that's 100% of your penis.
Yeah.
That is in big trouble for the rest of its and your life.
So chances are you've got what you've got.
Yep, you get what you get, and you don't get upset, right?
Yeah, you get what you. I like that. You get what you get, and you don't get upset. Ladies and gentlemen, Dr. Peter Stahl, board-certified urologist, nationally recognized leader in men's sexual health, and the senior vice president for men's sexual health at HIMSS. Thank you for being with us today.
Thanks for talking to me, Chad. It was really a pleasure.
If you want more uncomfortable questions and their very comfortable answers, make sure and hit that thumbs up button, hit that subscribe button, and we'll have more coming your way soon.